Now, we'll quickly move into the next aspect, okay, of rheumatic fever. Yeah, we've spoken about the clinical signs and symptoms before. Do you understand? So right now, I just want us to take it and talk about the disease condition in whole. All right. So this will serve as our introductory lecture to what? Acute rheumatic fever. All right. So for acute rheumatic fever, you could actually say it is actually something that actually affects the heart, but it actually started somewhere. Started as a mild sore throat, it wasn't taken care of, and the infection now spread to the heart. So you see it causes a lot of issues: skin patches, nodules, inflammation on the heart, and all of that. So acute rheumatic fever, we say that it's a serious inflammatory condition. So it's characterized by what? Inflammation. So it arises as a delayed complication of Group A Streptococcus. So you have had an infection from Group A Streptococcus. So basically this infection wasn't taken care of, or diagnosis was delayed and all of that. So it now led to what? The damage of the heart. So it's usually triggered by autoimmune response. So it partly comes in as your immune system is trying to fight the Group A Streptococcus organism that is in the body. Okay, so body's immune system mistakenly now will be attacking its own tissues, especially the heart, the joints, the skin, the brain. Okay, because those tissues kind of like look that they possess some things that kind of like look like the streptococcal stuff. That's antigens, right? So it occurs mainly in people that are between 5 to 15 years. So also people that live in places that there's poor sanitation, overcrowding, they are also at the risk of this. Then symptoms and clinical manifestation is the symptoms of like the acute rheumatic fever will appear 2 to 3 weeks after the person has had strep throat and it wasn't actually properly taken care of, right? So these are the symptoms. Okay, everything you see here, okay, everything you see on this side. Do you understand? All right, so you can pause to observe, but for me I'll just list it out. There's carditis, as inflammation of the heart. Migratory polyarthritis is you're having joint issues, but you have joint issues here, it will heal. Next time you're having a joint issue here, that's why you say it is migratory, it's moving from one place to another. Okay, the Chorea, Sydenham, Chorea. Okay, the person is moving involuntary like that now. Then Erythema, marginatum are the skin patches. Then subcutaneous nodules being the lumps, okay, on the skin. So diagnosis is based on Jones criteria, which is divided into the major and the minor, which we'll talk about it later. Then also results you get from the lab, of course. So treatment is you are dealing with a bacterial infection. So as you are dealing with the bacterial infection, basically, you can now use antibiotics, right? Then since you are also dealing with inflammatory conditions, you can basically still use anti-inflammatory drugs. Okay, that's basically what we have for the introduction to acute rheumatic fever.